So hi, how are you people? I hope you are well, keeping safe and doing well as we are doing. This is Laikipia Health Service, LHS, Doctor's Corner. Today we continue with the topic we were talking about last week, mental illness. We just but did an introduction. Today we want to go a step further by discussing one of the many mental illnesses that were highlighted. On set, I still have with me Dr. Ruth Gathuru, who is a consultant psychiatrist at LHS Nanyuki. Welcome on board.
Go.
Okay. Daktari, habari yako?
Salama sana Eva, how are you?
Niko salama. How have you
Yes.
been since last week?
I've been doing quite fine, working quite hard. Yes,
Thank you for finding time for us today. We really appreciate.
yes.
Now we want to go a step further and talk about one of the many mental illnesses you spoke about.
Yes,
We want to speak about bipolar.
yes.
So tell us, what is bipolar?
Bipolar disorder is a psychiatric disorder, and it's a mood disorder or a disorder of the mood. Okay, it is a serious illness that affects someone's mood, emotions, feelings, and even behavior. Yes, the reason why it's called bipolar is because it has two poles. Okay, it has a manic pole and a depressive pole. So like I was saying, bipolar mood has those two phases. Okay, so somebody can come from a depressive phase to a manic phase, or from a manic phase to a depressive phase. There's also something that comes in between called hypomania. Okay, so you find that there are two types of bipolar disorder. Okay, generally, basically, there is bipolar 1 and bipolar 2 mood disorder. You find that in someone's life, at some point in life, somebody may go into a depression. Okay, and then after some time, somebody may go into a manic phase. Yeah, and then someone may start with a manic phase, and then go into
Move to depression.
depression.
Okay.
Okay, a manic phase consists of very extreme moods, very high moods, whereas someone who is depressed has very low
Moods.
mood. Okay, so somebody can have like 3 or 4 episodes or even more in a lifetime. Okay, it is not a continuous illness like schizophrenia. It is an episodic illness. Okay?
So one moment you're on, the other moment you're okay.
Yes, what happens when you have that manic phase, say like maybe you got it when you are 20 years, okay? You'll be managed for that manic phase, and then you'll be well. You can even be well for even 2-3 years, okay? And then something happens to provoke you, and then you go into either another manic phase or a depressive phase. Okay, and you can move also from a depressive phase. You are treated for it, and then you stay for a long time or a short time, and then you go back into another depressive phase.
So let me ask a question.
Yes.
When you talk of mood, because
Yes.
you've used that word many times.
Yes.
It's the general mood, the way you hear people say casually, leo najisikia sina mood, sina psych. Is it that, or you're talking about something else?
No, I'm talking about something else, which is more serious, and indeed very serious, because it is a biochemical illness. Yeah, it's actually a brain illness. When somebody talks of feeling low today, tomorrow feeling excited, that is not illness. A bipolar illness has to be diagnosed by somebody who is trained. Okay, so this feeling of I'm feeling low today, tomorrow I'm feeling this and that cannot qualify to be bipolar disorder. And also, people have mood swings. Bipolar disorder is not also mood swings.
Okay.
Mood swings is something very different. Bipolar disorder, there's a way we make the diagnosis of the illness. When you are in a manic phase, there is a criteria we use.
Okay.
There are so many symptoms, like even almost 15 or so. So there is a criteria whereby we say if you have like 6 or 7 of these symptoms in 1 week, then that is mania.
Now let's focus on this. Huh?
Yes.
Maniac.
Yes.
So let's first start with symptoms. Then we can go deeper into what causes it.
Yes.
So what do you see in me, those 7 things you're saying,
Yes.
for you to conclude that this is mania?
First of all, when you are in a manic phase, you are very hyperactive. Okay? You feel so energetic, energetic, more than normal. Okay? You feel very excited. You feel extremely excited and extremely happy. Okay? Extremely. You talk so much. You talk a lot continuously, and then people laugh a lot. Okay? Laughing continuously, even for no good reason. Okay? There are those people who will sing and sing and sing and sing. Sing loudly, okay? Whether they are in the streets, whether they are in the house, whether they are at home, or wherever they are. Yeah? There are those people who are prone to maybe praying excessive more than they were before, okay? Continuously, even in public, even in wherever they are, at home, at night, they wake people up like that. Eh? So it may look to that person like it's normal, but it's abnormal, okay? That person may not understand that what they are doing is abnormal. But when somebody now who knows them looks at them, they say this person is not like that. They have changed. Because it's usually a change of behavior from normal to abnormal. Okay. The other thing that we find a lot in mania is something we call disinhibition. Disinhibition means you lack judgment. Yeah? You don't know the limits. You have forgotten limits. Yeah? Somebody can even come maybe to the doctor and maybe they want a hug or something from the doctor, you get, yeah? They have no boundaries. The boundaries are lost, the limits are lost, yeah? Okay. So the other thing that we find in mania is very generous people. They become extremely generous. Somebody can even give out all their clothes. Eh? Like I had a recent case of somebody who had given a plot or some land to the church. Eh? And because of other symptoms that he had, he was brought to me. And after treatment for the bipolar disorder, he was in a manic phase. Eh? Okay. After treatment, that's when he realized, did I mean to give? So some people become over-generous during a manic phase. Eh? They can even take money or even a loan even just to give out. Okay. They just want to give out. Yeah? The other thing about people who have mania is that they become hypersexual. Let us just say it. They don't have those boundaries. Yeah. So, like especially women are usually at risk of unwanted pregnancies during those phases. Yeah. The risk of the sexually transmitted diseases. Yeah. So there is that aspect of that disease. Okay. The other thing is that these people don't. When it comes to the night, they don't want to sleep. They can sleep for 2 or 3 hours and they are okay with that. Okay? At night, maybe they are listening to music, very high volume music. Maybe they are cleaning the house and washing dishes. They are very energetic. When others are sleeping, they are working. Very active. They are very active, and they are very energetic. Okay? Like I said, judgment is very, very poor. Okay? These people can even go and take a loan from the bank and buy some things that you wouldn't expect a normal person to buy. Okay? Just because they are in that manic phase. Okay. The other thing they lack is concentration. Okay? They lack concentration. So even when maybe a driver, when they are driving, they may cause an accident. Okay? Because of lack of concentration. But the other thing that we have noted about them, their memory is very good. Those people can remember things of long time ago. Okay? Their memory is very good. Their orientation is very good. Okay? they know, they know the date, that we call that orientation in time. They know the place they are. So they have not, they are not out of,
intact.
yes, their memory is intact, okay? Apart from the mood aspect, they are in touch with reality, okay? As opposed to people with psychosis who are not in touch
With
the
reality.
reality.
So probably the next question you help us answer is,
Yes.
You said it's a chemical thing in the brain.
Yes, it's
that
a chemical
happens.
imbalance in the brain.
So is there a trigger or what causes maniac?
Yes, there are triggers. And before I tell you of the triggers, there is a way we look at it. First of all, there are what we call predisposing factors of any mental illness. Okay? And then there are precipitating factors. Predisposing factors are factors that make you more likely to get that illness than the general population. Okay? This could be genetic factors, that means hereditary factors, whereby your relatives, maybe one of them or some of them had this bipolar disorder. Yeah? So you find that maybe your father, maybe you or your siblings, one or two of them have bipolar disorder, or maybe none, maybe it will come to the other generation. Okay? So bipolar disorder is highly genetic. Okay? Very, very much genetic.
Yeah.
But it doesn't mean that if there is no genetic predisposition, you may not get bipolar. You may still get it, yeah, for maybe just your brain weakness or something like that. Yeah. So apart from the genetic predisposition, there is also the childhood upbringing. Okay. The childhood upbringing also affects so much your mental state when you are an adult. Okay? If you had a poor upbringing, maybe you had a lot of torture when you are young, this may cause you to develop a mental illness like bipolar disorder in the future. And before we go into something else, before I tell you about precipitating factors, I've remembered there's something called grandiosity. We had not finished the symptoms. There's something called grandiose delusions, whereby people feel extremely important. Yeah, their self-worth or sense of worth or their self-esteem goes very, very high. Okay, they feel more important than other people. You get, yeah? They talk of being big things, exaggerated things. Yeah, like I had said last time, somebody may come and tell you I have like 10 million, 20 million in the bank, and they don't have. But they believe they have.
They have, yes.
Or somebody may tell you, I'm going to see the president tomorrow. Yeah, because they believe the president is related to them, yeah, or is their friend. And some actually even try to go even into state house. We have heard of cases where people have been arrested trespassing into the state house. Yeah, some of those patients have this bipolar disorder. Okay?
So, Dr. you spoke about precipitating factors.
Yes.
So, briefly mention to us, what are these precipitating factors?
Precipitating factors are factors that find you who is predisposed to bipolar disorder. They come at one point in your life and they provoke the bipolar disorder in you. Okay, they trigger a manic phase or a depressive phase. Okay, so you may be genetically predisposed, and you stay all your life without even getting any episode of bipolar, either depressive or maniac. Okay, but someone may along the way get a severe stress or a severe stressor. Okay, like something like maybe unwanted pregnancy, maybe failure in school. Okay, maybe business loss. Okay, maybe a loss of someone who is close to you. Yeah, maybe marital problems, some stressor which becomes so serious in you that it provokes or triggers a bipolar disorder. Or a mood disorder.
Okay.
Yeah. So those are some of the stresses or some of the triggers or precipitating factors of bipolar disorder.
So is bipolar treatable? Like, is there a point somebody fully recovers, or how is bipolar handled?
Yes, bipolar disorder is, fortunately, it's very treatable. Okay? Like I had said, it goes in episodes. Yeah? And between one episode and another, there can be a span of even 2 years or even 10 years. Or if some people, they get frequent episodes. Maybe in between they are like 3 months or 1 year. Okay? So treatment is not lifelong. Yeah? Unless those cases where the episodes are frequent.
Okay.
Okay? But this person who is getting an episode, yeah, like maybe at 20 years, is treated and does completely well, does not need to continue on treatment.
Okay.
Yeah? But if you find that the same person gets an episode after maybe a month or 6 months, at least 2 episodes in a year, that patient may require lifetime treatment. Okay? But those ones who have a phase in between of some years, maybe 5 years, 6 years, they don't have to stay on treatment. Okay? So treatment for bipolar disorder is there. So once you treat the current phase, yeah, whether depression or mania, it goes completely. Okay? But now it may recur.
So let's go to the society.
Yes.
How common are these cases of bipolar?
Bipolar disorder is quite a common illness, not just in our country but all over the world. The thing is that we may not exactly tell the numbers or the statistics properly because many of these people don't come out. Okay? They don't come out, first of all, because of stigma. Okay? Their families, once they discover these people are sick, they are hidden.
They abandon them,
yeah, or taken somewhere, or they are abandoned. Okay? So we may not really tell the exact statistics of bipolar disorder, but it is known to be more common than schizophrenia. Remember what I told you about schizophrenia last time? Yeah, bipolar disorder is more common.
Okay.
Yeah, but it is not. In the African setting, we have not fully embraced. I mean, these mental disorders. Yeah, because of the stigma.
Okay.
But you find that in the Western countries, people are able to discover early that this patient is actually sick. They need to be taken to hospital. Or even you yourself. The goodness about mood disorder, you know what is happening within you. As opposed to somebody who is psychotic, them they don't know themselves. It is other people who take them to hospital. Okay. For somebody with a bipolar disorder, you will discover
something is
I am
off.
talking a lot these days. I am laughing a lot these days. I am feeling so energetic these days. Yeah, I'm feeling so hyperactive these days. Like something has changed. Or I'm feeling very low. I'm feeling no interest in activities. I'm feeling like crying. You get almost all the time. I don't want to be with people. Yeah, I'm lacking sleep. Yeah, I'm lacking appetite. Although some people eat too much when they are depressed, or some in others they don't eat. Okay. So you find that there's some people who will lose weight and some gain weight when they are in depression. Okay, you find that some people oversleep. Yeah, when they are in depression, and some people lack sleep.
Okay.
Okay.
So how, as we wind up, what is expected of us as society towards these? Because it's not easy for us to pick this is bipolar. Probably we just say somebody has changed and start distancing ourselves. What is expected of us when dealing with people with bipolar?
Yeah, once you discover maybe yourself, you have a bipolar disorder, okay, or maybe somebody you are related to or a friend, the most important thing is to go to hospital early, okay? Seek medical treatment early so that you don't go into a severe phase of it. yeah, when it's depression, when you start maybe lacking sleep, when you start lacking appetite, those are symptoms that should concern you. And maybe let me say here, it is not just lack of sleep for 1 or 2 days, or lack of appetite for 1 or 2 days. That one can happen to somebody who is not sick. But when you see you are lacking sleep for like 2 weeks, okay, or you are continuously, or you are lacking appetite for 2 weeks, or you are feeling low energy, you are feeling weak for 2 weeks and more, okay, that should tell you there is something. A depressive phase in the medical work, a depressive phase takes 2 weeks.
Okay.
So if somebody comes and tells you, oh, I have not eaten for 2 days, that's not a depressive phase. Yeah? So there has to be a criteria of symptoms, a number of symptoms, and the duration of 2 weeks.
Okay.
Mania, on the other hand, those symptoms, the hyperactivity, shouting a lot, talking a lot, singing a lot, feeling over energetic, it has to happen in a span of 1 week, continuously. Yes. So if somebody just shouts 1 or 2 days, or talks loudly, or is very irritable just 1 day, that one will not say is maniac.
Okay.
It has to be, the number of symptoms have to be enough, and then the duration of those symptoms. Yes.
Okay. So that is it from Doctor's Corner this week. Remember, we are still talking matters mental illness. And my greatest desire as I host these shows is that you'll be able to look at yourself, think about yourself, seek out yourself. If among the many symptoms that our doctor is speaking about, you pick, say, 3 or 4, or even 5 of them, our facility at Laikipia Health Service Nanyuki is open. Our psychiatry department is always open. Reach out, come and seek help, because as we've been told over and over again, mental illness is treatable and curable. That is it from Doctor's Corner this week. We meet next week for another episode, still on matters you health. Laikipia Health Service, it's quality healthcare for all. Thank you.